ವಂದನೆಗಳು. ಆಮೇಲೆ ನಿಮ್ಮ ಎಲ್ಲರಿಗೂ ಹಾರ್ದಿಕ ಶುಭಾಶಯ. ಈ ಸುಂದರವಾದ ನಿಸರ್ಗದ ಸಂದರ್ಭದಲ್ಲಿ, ಈ ವಾತಾವರಣದಲ್ಲಿ ಭಾನುವಾರ ಇಲ್ಲಿ ಬಂದು ನಮ್ಮ ಜೊತೆಯಲ್ಲಿ ಕಾಲ ಕಳೆಯೋದಕ್ಕೆ ಬಂದಿದ್ದಕ್ಕೆ ಮತ್ತೆ ಒಂದು ನಮ್ಮ ಹಾರ್ದಿಕ ಶುಭಾಶಯ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ನಾವು ಹಮ್ಮಿಕೊಂಡಿರುವ ಪ್ರಕಾರ ನಿಸರ್ಗ ಫೌಂಡೇಶನ್, that's a wing of nisarga diagnostics and a spurti wing of residents welfare association of ACS Layout. ಇವರು ಎರಡು ಸಂಘದವರು ಒಟ್ಟಿಗೆ ಸೇರಿ ನಾವು ಇದನ್ನು ಹಮ್ಮಿಕೊಂಡಿದ್ದೇವೆ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಡಾಕ್ಟರ್ ಈಶ್ವರ ಪ್ರಸಾದ್ ಅಂತ ಈಸ್ ಎ ವೆರಿ ಪಾಪ್ಯುಲರ್ ಫಿಸಿಷಿಯನ್ ಆ್ಯಂಡ್ ಡಯಾಗ್ನೋಸಿಸ್. ಅವರು ಭಾಷಣ ಪಡೆದಿದ್ದಾರೆ ಆನ್ ಡಯಾಗ್ನೋಸಿಸ್ ಮಿತ್ಸ್ ಆ್ಯಂಡ್ ಟ್ರೂತ್ಸ್. ಅದರ ಬಗ್ಗೆ ನಿಮಗೆ ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ದರೆ ದಯವಿಟ್ಟು ಫೀಲ್ ಫ್ರೀ ಟು ಆಸ್ಕ್ and he will give suggestions and guidance. ನಮ್ಮ ಆತ್ಮೀಯ ಗೆಳೆಯ ಆಮೇಲೆ ಅವರಿಗೆ ರೈಟ್ ಹ್ಯಾಂಡ್ ಇದ್ದವರು, he was a roving ambassador for association and very active on the spirit-led every activity. It was a shocking news to us when we heard that he passed away on 4th of December. So I request all of you to stand up for him and let us observe what he has said. As well as nisarga diagnostics continuum to take over and introduce our chief guest of this evening, Dr. Ishwar Prasad. Thank you.
Thank you, sir. I once again welcome all of you for this second edition of our monthly lecture series program. And the topic will be diabetes, myths and facts. Our first topic was on stress management. It was a very crucial topic nowadays, and now again diabetes. I think most of you know India has become the capital for diabetes worldwide and particularly Bangalore. So I thought this would be a very relevant topic for this lecture series program. And today we have Dr. Ishwar Prasad, who is a consultant physician who is well known in Sanjaynagar and Bangalore North. He did his MBBS from Mysore Medical College and MD from Ramaya. After that, he joined the health services, Karnataka Health Services, and he was there for almost 10 years. Later, he is now actively into private practice, and his main focus is on diabetes management. So I thought he is the right person to give a lecture on this. So today he will be there with us, and he will give the lecture for about 45 minutes to 1 hour. We are lucky, and now I will call upon Dr. Ishwar Prasad to take on. Thank you.
Good evening, all of you. I thank the Nisarga Foundation and RMA Wellness Association for having given me an opportunity to speak on diabetes, myths and facts. And I will take half an hour. I'll explain first. I'll show you the video, which is 15 minutes. Then we'll have a group discussion. Whatever the facts, whatever the questions you have doubts, you can ask me. And I'd like to clarify. And last 10 minutes on the latest facilities or treatment available regarding diabetes. So first, diabetes, as you know, that whenever the blood sugar increases in the blood, that is more than 120 of fasting sugar and more than 180 of postprandial, that is after food, after 1.5 hours after food, that we call it as diabetes. So there are 3 varieties of diabetes. First is type 1 diabetes, then there is type 2 diabetes, and one more special variety of diabetes is called gestational diabetes, or the diabetes that occurs during pregnancy. And most of the time it will disappear as soon as the baby is delivered or after a few months of pregnancy. So majority of the things that will be covered now will be on type 2 diabetes. So type 2 diabetes, as you know, it usually occurs in elderly patients or in adults adults above the age of 40 years. Nowadays, the incidence of diabetes is started to occur even at the age of 30 years. It's because of the stress and unhealthy eating habits and the lack of exercise, stress and all that. So I'd like to show you the video right now, and then it is actually in 2-3 languages. So I'd like to show it in English first, and then Kannada, and then Vietnamese.
High blood glucose. This could be due to lack of the hormone insulin, or because the insulin that is available is not working effectively. Excess glucose in the blood can damage the blood vessels, leading to complications like heart disease, kidney damage, nerve damage, eye damage, and blindness. Impotent stroke and risk.
So these are the various complications that can occur due to diabetes. The diabetes is not controlled, and you can land up with heart problems. Then after high blood sugars can also cause kidney damage, and then it can also lead to impotence, and then also it can cause stroke. But the most important thing is it can cause the nerve damage and cause foot ulcers and all that. So the patient will not be knowing even with the injury or wound is there, he may not be able to breathe. So that these are the conditions, and also it can cause eye damage, that is called retinopathy, diabetic retinopathy. So this is the eye lens. It's not the lens. Lens it will cause cataract also, and also behind, in the back of the eye there is the retina. So that is the retinopathy. That is the main thing. That is one of the complications of diabetes. So
For infections, diabetes is incurable and has considerable impact on quality of life. Good control of blood sugar is the key to prevent complications. Apart from regular medication intake, 3 important things which play an important role in controlling your blood sugar are exercise, diet, and lifestyle. Let us see in detail the do's and don'ts to be kept in mind while adopting these measures. Exercise daily to increase energy and feel better. Increasing physical activity helps improve your blood sugar control and reduces the risk of heart disease and nerve problems. The American Diabetes Association recommends about 30 minutes of moderate exercise a day, at least 5 times a week. Do's. Consult your healthcare provider before beginning an exercise plan. Start slowly and increase activity gradually. Choose an activity you enjoy. Try a water exercise program, walking, riding a stationary bicycle, swimming or muscle stretching. Make exercise a lifetime commitment. Wear good shoes and take care of your feet. Test blood glucose levels before and after exercise. Bring a carbohydrate-based food along if you are taking insulin or an oral glucose-lowering medication. Exercise with someone who knows you have diabetes and knows what to do if you have a low blood glucose reaction. Wear a medical identification tag or carry an identification card that says you have diabetes. Don'ts. Don't get dehydrated. Drink water before, during, and after exercise. Don't take risk of low blood glucose or hypoglycemia. Follow a regular exercise, food, and medication routine each day. Don't participate in prolonged or strenuous exercise without first consulting your physician. During strenuous exercise, the body produces adrenaline and other hormones that can blunt the effects of insulin and cause blood glucose to rise. Don't ignore pain. You may cause stress or damage to joints. If there are eye problems, retinopathy, exercise should not be allowed till it is corrected. Eat a healthy diet.
So the usual advice is at least to do exercise at least for half an hour per day, as this is mentioned now. So all the exercises you can do, but it has to be slow and steady. You should not do it fast and which injures your joint or which you are not accustomed to. If you are doing regular walking, that is also good. At least better than sedentary. At least walking is also fine. The patient can walk, he can try for jogging or running, or he can do treadmill, or he can do other exercises as shown here. But do not do the exercise vigorously. If you have a heart problem, it has to be minimal exercise you have to do because it will precipitate the heart attack. And also before doing the exercise, if you are taking insulin and all that as usual, you have to check your sugars once in a way. You should never go to hypoglycemia. Hypoglycemia means the sugar is less than 70 milligrams. That is more emergency compared to higher sugars, like more than 200 and all that. So lower sugars will precipitate the heart attack and will cause more problem. So you have to avoid low sugars also. So if you are taking any insulin and all that, you have to do proper exercise and proper diet also to be taken, and also carry some amount of sugar water or any chocolates or biscuit, so that in case you feel hypoglycemic, you can always immediately you can ingest them.
So at this time, what are the symptoms of hypoglycemia?
Symptoms of hypoglycemia usually starts with dryness of mouth and then also sweating, and you will become tired, and also you will not be recognized your own friends, and then slowly you will feel sleepy. So like that it is a gradual process. Usually it starts with dryness of mouth and sweating and tiredness, not be able to walk, you will not remember, then you will go to sort of sleepiness or coma. If the sugar goes down to 40 and below, you will not be conscious. So you lose consciousness.
Watch the portion size. Before you take your food, keep in mind the food which should be avoided and the food items which can be beneficial for you. Dietary recommendation: sugar. Substitute sucrose with sweeteners like aspartame. Fat. Exclude fried items from your diet. For non-vegetarians, try and stop the intake of red meat completely and go in for a vegetarian diet. You can, however, eat lean fish 2 to 3 times a week. Whole milk and products. Switch to low-fat milk and its products like yogurt or sugar. Substitute sucrose with sweeteners like aspartame. Fat. Exclude fried items from your diet. For non-vegetarians, try and stop the intake of red meat completely and go in for a vegetarian diet. You can. And however, eat lean fish 2 to 3 times a week.
These are the calories that is equivalent. So usually for a normal person, we advise around 1500 to 1600 kilocalories of diet per day. So these are the items which contain so much of calories. So if it's all the non-vegetarian foods, so this is the measured size and these are the calories. So all the red meats and all that who are taking the non-vegetarian foods, they can have once a week of mutton, chicken and fish and all that they can have twice a week. Better to avoid meat, but if they are regularly used to it, they can have once a week of chicken and twice a week of fish.
Whole milk and products. Switch to low-fat milk and its products like yogurt or curd.
Products. So cow's milk with 100 grams will have around 265 calories. So buffalo milk of the same quantity will have 292, which is more calories compared to cow's milk. And then buttermilk with 100 ml will be around about very less calories 130 calories. And processed cheese and all that is better to avoid cheese. But in case you are having small cube of cheese, it will give you around 80 calories, which is very high. Then yogurt and all that, and these are the things. Better to have soya milk and processed powder, don't milk. These two are the less calories.
Do not have more than 2 cups of tea or coffee every day. White flour. Replace these with whole grains, whole wheat or soya breads, and unpolished rice. Avoid white rice, potatoes, carrots, breads, and banana, as they increase the blood sugar levels.
These are the vegetables. So if you are having a cooked beef with paneer, which is about 130 grams, with approximately 1 bowl, will give 190 calories. And fish with potato. Potato will tell you to avoid, but in case you cannot, you can have a very less quantity, and you can have more of gravy or more of water. That will have 132. Potato curry itself with 1 bowl, measuring 3/4 of a bowl itself will give 131 calories. And fried vegetables and curry will have very high calories of 270.
Fruits. Eat 5 servings of fruits and vegetables daily. Fruits which contain mainly slow-release carbohydrates help to regulate blood sugar levels better. Examples are apples, pears, oranges, peaches, plums, and strawberries. Fruits that are absorbed quickly and release a quick burst of energy, such as banana, pineapple, watermelon, sweet melon, and papaya, should be avoided.
These are the fruits. So, what are the fruits?
And vegetables daily. Fruits.
Usually we advise 5 servings of fruits and vegetables, or you can have at least 4 servings or 3 servings is also okay. So fruits which are very fastly absorbed, we call it as high glycemic index, which are slowly absorbed, we call as low glycemic index. Glycemic index means, suppose you take a teaspoon of sugar, it will immediately go to the blood and the sugar level will rapidly rise. Whereas if you take a low glycemic food, that will take minimum 10 to 15 minutes to reach the higher sugar levels. So apple, if you take, that will be very slowly absorbed and increase the blood sugar very slowly. Whereas something like banana or mango and all that, which will have high glycemic index, will immediately absorb and the blood sugar will shoot up. So try to avoid the blood sugars with high glycemic index.
Regulate blood sugar levels better. Examples are apples, pears, oranges, peaches, plums, and strawberries. Fruits that are absorbed quickly and release a quick burst of energy, such as banana, pineapple, watermelon, sweet melon, and papaya, should be avoided. Following general guidelines should be followed for your daily dietary intake. Do's. Eat food at fixed hours. If you are on insulin, make sure you have 3 proper meals with light snacks in between. Drink the bottled water that will help flush the toxins of your system. Make sure the gaps between your meals are short. Have at least 20 to 25 grams of raw onion daily. Include sprouts in the diet. Sprouts are a fountain of nutrients. Don'ts. Do not eat fast. Masticate and munch your food well before you swallow.
Whenever you take any food, it can be fruits, vegetables, or whenever you have lunch also, proper mastication will definitely increase the digestion, and also it will stimulate the pancreas to produce more insulin. So definitely mastication and proper chewing is always good, and at least 5 to 6 times, whatever the food you are going to keep it in the mouth, whether it's vegetables, fruits, you have to properly masticate and then eat or swallow.
Do not eat immediately after a workout. Do not overeat. Do not skip meals. Skipping meals may cause hypoglycemia or low blood sugar. Normally, when your blood sugar drops too low, below 70 milligrams per deciliter, you develop symptoms such as shakiness, sweating, and a fast heartbeat. These symptoms alert you to the problem so that you can take steps to raise your blood sugar quickly. Remember that untreated hypoglycemia can be fatal. Adopt healthy lifestyle. Healthy lifestyle choices may decrease your chances of developing complications from diabetes. 1. Limit the amount of alcohol you drink. Drinking alcohol can cause a dangerously low blood sugar. Do's. Monitor your blood sugar before, during, and after drinking alcohol. Remember to check before going to bed. Always